Empty store shelves of hand sanitizers, and then some people saying, why are we talking about this so much? This is Dr. Lee Norman. He is the secretary for the Kansas Department of Health and Environment, the lead medical opinion and authority in the state of Kansas, where we are now seeing one presumptive case of coronavirus. So people want to know, what's the appropriate amount of worry here? Should we not be worried at all, or should we be very concerned?
Well, certainly we should be worried. We're going to have more coronavirus in the United States. We're going to have more in the Midwest. It's been a little slow to come to the Midwest. It's been mostly on the coasts and the larger airports where things seem to be imported. But I think between panic on one end and no concern on the other is a healthy, reasonable place to be.
Okay, and we were talking before the show about we're going to know a lot more in the coming days and weeks because of what we are seeing happening around the world.
Yes. Yeah, China, has been very active for months now. Europe is lagging about a month behind China, and the U.S. is lagging about a month behind Europe, just in terms of the evolution of this epidemic, and call it what it is. And so we're going to get more cases, and the next 2 to 4 weeks will be very enlightening.
You are certain it is going to get worse before it gets better here?
Yes. It's really a fascinating discussion. What's the new normal going to be? Is this going to be seasonal, i.e., influenza is still a lot of influenza out there, but it's tracking down now as we get into the spring and summer. Will this new coronavirus act that way? Will it be seasonal right off the bat? We have no way to predict that that's necessarily the case. It might be the case. There's a coronavirus that's not the same one as this one in the Middle East, the Middle East respiratory syndrome. It's been active now for 7 years. It didn't peak out until the 4th year.
So the 4th year. And we don't want to scare people. This is about information to empower you. We're getting a lot of questions. We've heard some reports over the weekend that children don't tend to be affected at least as much as the elderly and people who have underlying conditions.
That's true.
Now we're seeing questions from some of our viewers about children with underlying conditions. When do they start to change their daily life?
I think that they should start considering and doing that now, actually. Remember that there's a lot of other respiratory illnesses out there, still a lot of influenza. If somebody has an underlying immune deficiency, they maybe didn't respond as fully to the influenza vaccine, for example, so a little bit more vulnerable to that. The same precautions for coronavirus are as for influenza in terms of hand washing, not touching the face, cleaning surfaces and the like. I think that if I had a young child that had an immune deficiency or some other medical illness, I think I'd already be avoiding large crowds, for example. Regardless.
Talking about, this week, Big 12 comes to town. Tens of thousands of people are going to be around. If you are one of those people that is healthy and is not a part of the elderly population, doesn't have an underlying condition, do you need to worry about going to places where there are big crowds?
Well, there's been so little coronavirus in Missouri and Kansas that a person, as long as they exhibit good hygiene, if you will, with hand washing and that kind of thing, they probably will do fine. You think about the area around yourself, and it's very crowded in a sporting event. People are yelling and screaming and coughing. So it's an environment that would be ideal for transmitting viruses. We say usually 2 seats in front, 2 behind, and then a circle around about that same amount. But we've had very little coronavirus, just the one case on the Kansas side. I think it's probably fine, but if we started getting just taking off like crazy over the next week or so, I might have different kind of advice. The state of Washington certainly shows that. Over a 10-day period of time, it's just grown like crazy, the number of cases there.
So we say the risk is low, but we have to say for now. Right?
For now, yeah, I think people just have to keep an eye on high-quality news. And for example, I know they can go to our website, kdhe.ks.gov. We post every day the number of tests we're doing, the number of positives. We are fully transparent with what's going on out there. There's no attempt to hide any of this information. But, and I think people just have to understand what is the burden of disease, how much of it is out there.
If a lot of people have spring break trips planned, they're getting on a plane, even in the United States in the next couple weeks. With so much that we don't know yet, would you change travel plans, or you say it's okay for now?
I wouldn't have just one answer. Okay. I would say if you're going to Seattle, Washington, you better rethink that and maybe postpone. If you're taking a driving trip to you know, to Utah or something like that, and it's a small carload of healthy people, I'd say fine, have a great time. Then there's the middle ground. I'm going to Florida coast with spring break or South Padre Island or something like that. The drive down will be straightforward, but I'm going to get there and there's going to be a bunch of bar hopping and, you know,
being around a lot of
gatherings
people.
and dancing on the beach and whatnot. I'm not so sure. I think I'd still take the trip, but I'd avoid large crowds.
Just be careful when you are about. Man, this is developing obviously by the day. Thank you so much for coming on with us.
You're welcome.
And we have a forum at kshb.com where you can ask questions, and we will continue to try to find those answers for you because we're learning more every day, right, Bryant?
We certainly are.